Welcome to the African Alliance podcast, the Brilliant series, brought to you by the Brilliant Consortium's Community Engagement and Advocacy Workstream. This series introduces you to the scientists, researchers, and community activists driving innovation and social progress across our partner sites. In each episode, we'll hear from those on the front lines, whether they're uncovering groundbreaking scientific discoveries or working to empower communities through grassroots activism. These conversations give you an inside look at how collaboration between science and community is transforming lives, challenging systems, and creating solutions that can change the world. In this episode, I'll be speaking to Izukanji Sikazwe, the Chief Executive Officer for the Center for Infectious Disease Research in Zambia. A very warm welcome to you, Zuzu. You are, of course, a long-time Zambian scientist, a researcher. For decades, you've been at the forefront of infectious disease research and implementation science. You've been a consistent thought leader in moving the field forward to ensure that Africans can live lives of dignity and health. Today, you lead the Zambia Center for Infectious Disease Research, or CIDRZ. And today we speak to you as one of the leaders of a 5-year multi-million-dollar partnership with the United States Agency for International Development and PEPFAR to advance HIV vaccine discovery work on the continent, along with some of Africa's leading scientists, researchers, and community activists. This series of podcasts, of course, is brought to you by the Community Engagement and Advocacy Workstream of that Brilliant Consortium, which will span 5 years in 8 African countries. Zuzu, a very warm welcome to the podcast series.
Thank you so much, Tian. I'm excited to be here, and I think you've overly embellished my my resume. But thank you for being so generous and for having me. I'm happy to be here.
Zuzu, could you describe your role firstly at CIDRZ and then secondly your role within the Brilliant Consortium?
Okay, so CIDRZ, like you said, is a nonprofit health impact organization here in Zambia. And it's been in existence for over 20 years now, since 2001. I am the current Chief Executive Officer, and I lead the overall oversight of this organization. But at heart, I'm an HIV clinician provider, and essentially that's what I'm passionate about, taking care of my patients living with HIV and ensuring that they have the best possible care that I can provide. And then I guess my second hat is that of a researcher. And as a researcher, my work has really been focused around how do I improve the outcomes of people receiving antiretroviral therapy? How do I improve their outcomes so that they have the best possible life despite their HIV diagnosis?
And could you describe your role within Brilliant?
So Brilliant, as you know, is a consortium of different organizations spanning several countries on the continent. And for Zambia, I am the site investigator. So I lead Brilliant's work here in Zambia together with my team of community advocates, researchers, and investigators. So I lead the Zambia team.
So of course, Brilliant 5-year long, we're almost at the end of year 1. What has the first year been like for you in terms of some key lessons, takeaways? We know that Brilliant 001, what we refer to as the first jewel in our crown, has not quite kicked off yet, but we're of course very excited to see that happening. But from a CIDRZ point of view, what has the first year of being engaged in this consortium looked like for CIDRZ?
So a lot of learning, trying to understand the different partners in Brilliant, trying to understand the mandate of Brilliant and what will be held accountable for. And more importantly, how do we move the agenda forward so that we can engage in real science that will impact the lives of Africans and others across the world? Because really, if we are able to meet the objective of Brilliant, it will impact millions across the world. So for year 1, one of the key lessons is that no one group or no one team can do it alone. It has to be a collaborative effort. Each of us come to these partnerships with our unique strengths, as well as our weaknesses, which I hope the other partners will be able to turn those weaknesses into strengths. So it's been more around learning and figuring out how does CIDRZ and Zambia fit into this Brilliant consortium.
So Zuzu, a lot of what we'll speak about during this discussion will in some way, shape, or form, of course, touch on research in general and clinical trials. And of course, one thing that is very prominent in many activists' mind these days, and I'll get into it a bit later, is the issue of access. There seems to be an increased awareness, rightfully so, we believe, on research for what and research for who, clinical trials for what and clinical trials for who. Is it too early to speak about access in the context of Brilliant? Is it too early to ask the questions around what are our plans for ultimate access in the context of Brilliant? Do you regard Brilliant within that framework landscape? Or is it too early? Is Brilliant not the space to be discussing access and more the space to be looking at these various streams of discovery medicine?
I think that it's never too early to have that discussion around access. It should be part of the discussion right at the get-go. Because if we think that we'll have a product and then spring it on communities, spring it on governments, spring it on funders, and expect them to take it up and run with it, then we're totally missing all the hard lessons that we've been taught, especially in the HIV space. If you look at PrEP, PrEP was supposed to be a magic bullet for us. And up to now, we're still trying to get good uptake and continuity with PrEP, and it's not happening. So access has to be talked about and thought through right from the get-go. And it has to involve all the different stakeholders in the continuum of care, or in the continuum of making sure that the product is made available to those that need it.
So, Zuzu, you've written in the media about the international community and them being very front and center in the fight against HIV in a lot of our work. Of course, nothing was more of a powerful reminder than COVID. When we saw a pandemic characterized by really gross inequality in terms of access, privilege, and power. And as I was reading through the piece, I was wondering that, of course, solidarity is important, networks are important, but today across this continent, you still have far too many groupings who are located in the minority world or global north, who still retain leadership positions, who still demand a piece of the funding pie, who are still very vocal and visible in the African response and the leadership of the African response. You still have groupings and initiatives where the funding pie is being divided by really allocating funds for Africa to, either technical partners or supportive partners in the global north. And as you wrote about this need for Africa to take up its true leadership role, I began to think, what would it take to break this pattern? What would it take to find our courage? Do we lack courage? Do we lack voice? Do we lack platform? Do we lack a critical mass of activists and brothers and sisters who can be that wind under our wings when we stand up and be that solitary voice and speak out and ask these hard questions? Because very often these hard questions are asked of beloved colleagues, beloved organizations that we've grown up, in the sector with. And it's exceedingly difficult to now ask these difficult questions. It's almost like the problematic uncle in the family, where someone now has to stand up and just ask the question, in terms of, actually in this family meeting, you actually don't need to be there. Give us our space. We'll speak. So where are we going wrong? When do we get to a point where the amount of colleagues in the global north who fly into Africa to provide technical support, the good old, I'll just be there to support, I'll sit in the back of the meeting, I'll take notes. We've been there, we've seen that. But how do we get to a place where we can truly say we are enough?
So I hear what you're saying, Tian, and I think to start off with, we have to recognize the tremendous support and help that we've got from our partners from the global north. We would not be where we are today recording some of these remarkable achievements without that partnership, without that support and solidarity. But what you also say is right. You know, we as Africans, or those most affected by this disease, or those that find themselves in a situation that, you know, impacts them in a very negative way, have to stand up and be able to voice and take actions to right whatever it is that is not going well. So for starters, it's about understanding where we are and why we're here, and holding ourselves accountable. Why have we let this happen? Okay, why does it continue to happen? Are we shying away from some of our responsibilities? Who is it who's supposed to be the leader? Who's supposed to be, you know, in the forefront and fighting for us? And if we wait for someone to fight for us, then they will come in and take up that space. So we have to stand up and take up that space, but we have to take up that space and arm ourselves with full knowledge, you know, like make sure we are well trained. We understand the problems. We cannot go there half-baked and think that we'll sort out our problems if we don't understand what those problems are. So, you know, getting that technical expertise amongst ourselves, making sure we're well trained, we can articulate the issues that we face, and coming to the table with the full confidence to say, we do have a right to be at this table and we need to be able to participate in these discussions. But I think for Africans, we also have to look at our leadership, our politicians, you know, are they letting us down? What are they doing that puts up these barriers or these challenges for us to fully participate in these discussions? Could they do more when it comes to improving the health security of their populations or their citizens? Can they do more to improve the food security of their populations or citizens? And if they're not, what are we doing as citizens to address that and hold them accountable? There's always talk about, you know, corruption, fraud, and misappropriations amongst Africans, but it's not a unique problem to Africa. It happens there as well. But the issue is, are there systems that are in place, effective systems that can hold people to be accountable for those actions, and to ensure that, you know, issues of corruption or misappropriation are not perpetuated or are not covered up? So as Africans, we really have to come to the table and say, this is wrong. We need to have people be held accountable for some of the things that they're doing. And we also have to build each other up. Like I said at the beginning, BRILLIANT has been able to show me the different strengths and weaknesses of the different consortium partners, but together we're able to shore up those weaknesses and build the capacity of those that may be lacking in some key areas. And as Africans, we have to rally around building each other up instead of bringing or pulling each other down.
Could you describe in a very practical way, what do we lose when our voices are not at the front and center of the response?
Primarily, I think our need or our priority is not articulated. So then you get a solution for something that was not a problem to you. I may come to you, Tian, and say, oh, Tian, you clearly need more water, okay? And your issue is not more water. Maybe your issue is, I haven't even got the seed to plant in my ground. So even if you give me the water, my seed won't come up. So we need to be able to say, we need 1, 2, 3 things. Let's have a discussion about what we need. From where we sit, these are the priorities. And because we may be lacking maybe the expertise, and that's in quote unquote, or the funding, and again in quote unquote, because I do think that there's a lot of funding and resources here on the African continent. It's just how it's allocated and how we prioritize what we're going to fund. So being able to come around and say, these are the priorities and these are our needs, and this is how we think you can come in and support this agenda that we have. But it has to be the right agenda. It cannot be an agenda that is self-serving, that only benefits me as Zuzu, or benefits CIDRZ, or benefits the research for X, Y, and Z, or propels my career. It has to be an agenda that benefits the population at large. And I think, you know, to be honest, there is some self-serving that happens even within this space. And we can blame the global north and saying they come in and parachute and do their research and go away. Even amongst ourselves, we're doing that to each other. So this self-serving, trying to propel your career or your institution or your science, your agenda has to be addressed as well. It has to be called out.
Always difficult to hear, but I think on point, because of course it's always easy to look abroad and blame those who came on a ship. Well, they no longer come on ships, they come on planes, but yeah, the harder work to look.
Some of them are already here, they are us. And when it is us, we should be able to have those discussions as well.
This is the Brilliant series of podcasts, brought to you by the Consortium's Community Engagement and Advocacy Workstream, introducing you to the scientists, researchers, and community activists at the center of HIV vaccine discovery. Today, I'm speaking to Agnes Kabamba Chitoshi, the Community Liaison Officer for the Center for Infectious Disease Research in Zambia. Today, I'm speaking to Izukanji Sikazwe, the Chief Executive Officer for the Center for Infectious Disease Research in Zambia. I was reading a piece by Kelly Chibale, who, of course, established UCT's Drug Discovery and Development Center with the, really main aim to bridge this gap between labs and patients. And he was speaking about how Africa's got the greatest variety in human genes anywhere on the planet, but the world is failing to capitalize on it. He called it an opportunity that required persuading more African people to volunteer to take part in research, and governments needing to be more open to hosting trials. We've written a few op-eds and have something coming out shortly in one of the journals around for how many years activists have been calling for this new level of consciousness amongst researchers and scientists, because we continue to ask the hard questions of if our national institutes, if our national universities, if our research institutes are even beginning clinical trials without securing meaningful access commitments from their pharma partners. Is that actually good science? And we're almost verging on a narrative of betrayal. We've seen it with lenacapavir. During COVID, we managed, as part of a grouping of civil society, to secure a statement from the United Nations Committee on the Elimination of Racial Discrimination, who actually said that the pattern of unequal distribution of life-saving vaccines and COVID technologies between and within countries manifests as a global system, privileging those former colonial powers to the detriment of formerly colonized states and descendants of enslaved groups. So this UN body characterized our collective racist response to the pandemic and almost compared it with times of slavery and colonization. And so communities are seeing this, of course. Communities are seeing, studies like, long-acting PrEP injectable studies. They're seeing pharmaceutical companies who use public funds to undertake licensure trials, but resist regulatory registration. We look at CAB-LA that remains out of the reach of communities who need it most. We look now at the global acclaim for lenacapavir, and just constant praise around this, almost, this groundbreaking, world-changing HIV option. But again, communities are left out. Communities who make this research possible. Communities who, without the research, won't happen. But we continuously train these communities. And so if you look at all of that, combined with Dr. Chibale's call for Africans to take part in more research, it's quite staggering the amount of trust that we want communities to place in us when so much of the evidence is pointing to the contrary. So much is telling communities that if you participate in my trial, when the trial is done, thank you, we're off to make profits. We tracked pharma billionaires during COVID, and there was another reminder of how the system, the current status quo, is set up against communities. There's so much evidence that shows that communities are not benefiting from the fruits of research. And even more, shockingly, outrageously, communities who take part in these trials are not seeing the fruits of that research. So considering Dr. Chibale's comments, considering all the work you are doing, considering what we saw from COVID, the current spectacular lack of access, the betrayal that is access to PrEP, what is your message to communities? Why should communities continue to trust us as a collective? Why should communities continue to enroll in trials? Why should communities continue to trust the system that has systematically let them down with no clear commitment in sight? We have yet to see a scientist or a researcher stand up and refuse to conduct a trial because there's no commitments from pharma to ensure post-trial access. So what would be your message, as one of the foremost researchers and scientists in this space? What can you tell communities?
Yeah, so I hear you, Tian, and it's really, really heartbreaking and discouraging, especially at this point in our lives, decades and decades into this epidemic. And not just the HIV epidemic, but across different diseases that have been of public health interest. And seeing how communities have been let down, even in the 60s and 70s with the Tuskegee trials, and how, people that received those drugs were not taught about the potential side effect. So it does erode trust. But I want to go back, when you talk about access, go back to the discussion that we had. Access has to be talked about from the very beginning, and it has to be talked about with all the players that, either facilitate or hinder access right at the beginning, before the money starts to roll in, before the science does prove that it is actually efficacious. Access has to be talked about right at the beginning. And when you look at BRILLIANT, who funds BRILLIANT? As African, who funds BRILLIANT? Where are our leaders, our politicians, our African Union, our Africa CDC, and, philanthropy that is African? When are they going to come together to put money together to fund African researchers and institutions to undertake groundbreaking or discovery science that would impact the lives of millions across the continent and globally? So when you start to have your governments, your leaders stepping up and saying, this is where we're investing, we care about you, and communities see that, and they see their leaders putting their money where their mouth is, then you start to build the trust. But it has to be a multi-pronged approach. It cannot be done once, especially when we're coming from a history where we felt, thrown out and not engaged and not supported. So how do you start to rebuild that trust? And it would take continuous discussions, engagements, and an appreciation of my take on it is actually valued. It means something, and it's not just, a checkbox. We had community there, or we had a Zambian there, or we had an African there, or we had a young person there. But really, we had them there, and they contributed, and this contribution has been incorporated into our strategy moving forward. It's not easy, and I think we all have to stand up and acknowledge what has been done, but then also look forward and say that this is where we want to go, and how do we support whatever research it is, whatever disease it is, how do we support that? And now I think there's a lot of communication channels that sometimes as researchers, scientists, maybe even governments, you ignore. Your social media, how do you use social media to positively engage and disperse knowledge, improve the literacy amongst your communities or your population about whatever the intervention is? Can we intentionally have these discussions and not think of it as an afterthought? Say, oh, you know what? We didn't get the young people around the table, or we didn't get the women, or we didn't get the old people. And suddenly you're rushing around, because then they feel like, well, you went 10 steps ahead without me. You might as well continue. And then we'll see whether I will support you or buy into whatever intervention you're planning. It's not part of me. I was not part of it. So I'm not going to support it or participate.
Yeah, truly the old adage, nothing about us without us.
Yeah.
comes to mind. But so if I could just probe a bit there, for over a decade, we've been calling for meaningful community engagement. And of course, one of the privileges we have within the BRILLIANT Consortium is this year completing baselines in all of the countries to exactly understand what does each country understand by this concept of meaningful community engagement in research. But we've been calling for that engagement from protocol design to post-trial access. Could you describe briefly CIDRZ's own position on ensuring that meaningful engagement from protocol design to post-trial access?
Yeah, and I think take a step back. What does meaningful engagement mean? And, the ones that you want to meaningfully engage should be able to define what that looks for them. I cannot, for example, tell my husband, you're not engaged. I have to tell him what I'm looking for him to understand, oh, this is what Zuzu means when she says, I'm not engaging, I'm not responding to her, I'm not listening to her. So we have to define what that means. So the different stakeholders, in this case, we're talking about community, they have to define what that truly means for them to feel, listened to, heard, and seen, and to say, truly, yes, we've been meaningfully engaged. But just generally speaking, what we've tried to do here at CIDRZ is to have an advisory board, a community advisory board. And we've had one that was just a broad community advisory board. But over the years, we've tried to incorporate a more youthful community advisory board. So there's 2 different advisory boards that we work with. And we try to increase or strengthen the knowledge around research and what research means, and be able to define some of those scientific terms in a way that we all can understand, that we all have the same understanding of what some of those scientific terms mean. And one key thing that I appreciate, community advisory boards are made up of a very diverse population, with different skill sets, different educational levels, different socioeconomic levels. And you have to have a really diverse group in those community advisory boards. You cannot try and have your community advisory board just comprised of disadvantaged people, because then they're vulnerable and maybe they won't be able to really give you good feedback if they're speaking from a position of less power. So you really try to make sure that you have a good representation of what your community looks like. And and I digress a little bit, like how the HIV world has always relied so much on volunteers, and volunteers traditionally were those that were not gainfully employed. And then you kind of just told them, do this and we'll give you a little bit of money. This is so wrong, it's so wrong. And so with the same, when you put these community advisory boards, you really must look through and say, have a good representation of what your population looks like, and be able to provide them with the necessary training, literacy, whatever aids that they need to understand what is going on. And with protocol development, which you asked specifically about, I think it's being able to define the hypothesis of the study, talk about it, and let them know what you've put through in the protocol, and then start to get their input in the different segments so that they really do fit into that protocol and can tell you, especially when it comes to certain things around maybe eligibility criteria, follow-up, engagement strategy, retention strategies, being able to define what the intervention product is in a way that they understand it so that they're able to tell others about it, be able to take in their concerns around safety, potential long-term side effects. So it's really critical that communities engaged and participates in traditionally what was a space for just scientists or researchers.
So, Zuzu, in your capacity as co-chair of the African-led HIV Control Working Group, you co-authored an opinion piece that was calling for African leadership and the financing of the health response, especially on HIV. Why are we still here after years after the broken promises of Abuja? why are we still here? What is the critical action that needs to happen to galvanize those who dare to call themselves our leaders to actually come to the table and do right by their people when it comes to the money, the financing of the response?
Yeah, and especially in this time and age, we're living in challenging times. A lot of African countries have enormous external debt to private lenders. So they have to pay back at really high interest rates. And when you look at their GDPs, they really cannot afford those repayments. Some countries like mine have gone into default and they've had to renegotiate. So there's a lot of competing priorities, climate change, other epidemics, and so on and so forth. But fundamentally, I think our leaders have to come around and reprioritize the health security of their citizens, of their populations. And it's just not about HIV. I think more broadly speaking, the health security of individuals has to be prioritized by countries. And this health security is broader than just disease. Or disease treatment. It's around disease prevention, nutrition, education, because all those things will feed into prevention of diseases.
You were part of the first cohort of the inaugural Kofi Annan Global Health Africa Union CDC Leadership Fellows Program. What was your focus during that fellowship?
There's a lot of talent in Africa, a lot of talented individuals doing remarkable work from diverse backgrounds and accomplishments. I went in with a medical background, but then met others that were from a legal background or finance background, and all coming together to really work towards improving their leadership skills and attributes in order to be impactful in their local setting. It's a really good program, well put together with faculty that are African. I think when you're in a room and listening to accomplished individuals that look like you, speak like you, and have had shared similar experiences in terms of perhaps challenging socioeconomic situations or conflict in their country or political instability, but then hearing them speak about that journey and where they are now and the impact they have in terms of securing our public health, it's just phenomenal. And then it makes you realize that we do inherently have a lot of resources within us or amongst ourselves, and we do have the ability to be able to change our trajectory, irrespective of what that trajectory is, whether it's in disease, our finances, or whatever. We do have the ability to change that, but it takes a certain mind shift and approach. You have to be self-aware, you have to be disciplined, you have to work within your network or expand your networks, be able to bolster others that may be lagging behind, as those that are in front of you give you a hand up and lift you to get you to where you need to be. It also pointed out some of the imbalances between the global north and ourselves. And for instance, if you take manufacturing of even just the HIV test kits, we use billions and billions of test kits on our continent. And since the start of the epidemic, we've used the most. And yet there is, maybe now it's changed, but last time I checked, there was no manufacturing capacity on the continent for HIV test kits. It's all being outsourced to other countries, and we end up paying for those products. So I really loved that 1-year engagement that the Africa CDC put together with the Kofi Annan Foundation. And it's a great training program that just opens up your mind to what's the potential of Africa is and what's possible.
Across the continent, of course, women and young girls just face such, this veritable onslaught of everything going against them, from patriarchy to misogyny to violence to unequal access to opportunities. Literally, almost everything goes against their happiness, their dignity, their safety, their prosperity. What would be your message to a young woman, a young girl who's trying to find her way in this space, trying to carve out, opportunities to get, their first article, their first authorship, their first paper at a conference. They're trying to be heard, trying to be seen against this tsunami that stands against them. And of course, despite those tsunamis, I think a lot of the progress we've made in this space is because of African women. It's because of Black African women. Years ago at one of these big scientific conferences, I remember trying to remind the audience. Of course, no one acknowledged the comment afterwards. Of course, the translator came out of a booth and said, "Thank you so much for saying that," because of course it was a room full of scientists, and I basically reminding them that all of their Lancet papers, all of their covers of magazines, all of their accolades, all of their national awards and honors would mean nothing if it was not for Black African women who made the research possible, and whose backs they continue to ride. What is your message to that young woman trying to find her way in this space?
I hear what you're saying, Tian, and it's tough. And I'm speaking as an African woman, not so young, but I remember how it was for me. And I think fundamentally, we have to remember that a young girl is nurtured and supported by her family. So trying to start from those early days, and I know some young girls and young boys too will not grow up in a home that is stable with both parents or without their mom, and they'll be raised by the extended family. But it's important that system, whether it's mom and dad or mom only or extended family or grandma, nurtures and supports that young girl. And I'm going to say the young boy as well, because I think half the problems we have is because of the other gender. So it has to be both. And, my parents always believed that I could do more, and they pushed me to do more. And even when I got into medical training, there was always somebody who I think believed that I could do more and would always challenge me. And having that external support bolstered my confidence and my hunger to do more, to read more, to learn more, to experience life more, to experience whatever it was more, because somebody always was there pushing, gently guiding me. So I think what I'm saying is, as the older generation, can we truly and intentionally try and figure out how to be supportive to younger people, both men and women, and how to support their growth and make opportunities available to them, be able to mentor them and shepherd them along the way, but also ensuring that we have a relationship that allows them to be okay with failing or not reaching a certain target, and working with them to overcome that barrier. So really I think I've just been enormously supported, both by my family, my work colleagues, my supervisors in my earlier jobs, in training, my registrars and consultants. There was just always this very supportive environment that allowed me to continue to grow. I'm not saying that, I didn't face challenges, or the young girl, the young woman won't face those challenges, but, working with her network or her support system to figure out how to get around those challenges.
So of course, it's a very different world. Our world is constantly changing. But now more than ever, you almost have a global affront on rights, on bodily autonomy, on freedom, on a range of communities who are viewed as vulnerable globally as well. So now, to your fellow researchers, to your fellow activists, what gives you hope, especially in this time? You know, we're on the verge of seeing new leadership at the NIH that has been vocal against vaccine research. We're on the verge of seeing a range of political appointments across the continent that instill fear, that instill doubt, concern, anxiety. It's a very dark energy that's hanging on our sector, on our, you know, in the field in which we work, to defend science, to stand up for research. What is your message to your fellow researchers, activists? What gives you hope? Are you hopeful? And if so, what gives you?
I think, Tian, like, of course, I'm hopeful. And I would say to anybody who's losing hope to think back to the 1980s or even to the 1970s, those first few cases of individuals that had this disease that nobody knew or knew how to respond to. Just think through the amount of fear that they had. And if they had, you know, reacted to that fear by sitting back and cowering and not, you know, pushing that fear down and instead trying to push forward and find a way to understand exactly what was going on and to chart a new way forward, you know, that opened up all the activists that we see and have supported our work and have led us to where we are now, opened up new avenues of research, opened up new avenues of funding. We cannot let the fear run us or rule us. It's important that we see it, we recognize it, and understand what drives it, and then be able to think through what then do we do, and how can we get past the big hurdles or challenges that we're facing to get to the other side, because constantly we'll be fighting to get to the other side. You know, we think that, you know, when one challenge ends, then it's coasting, smooth sailing. No, that's not how life is. Something else will come up and something will make us fearful again and start to question ourselves. But we must continuously just rally and understand what's driving the challenges and think through what the potential solutions are and power through that. And I think I'd like to end with the words of Paul Kagame, His Excellency, the President of Rwanda, in terms of pushing our voices and making our voices heard and participating, but participating and being more proactive and intentional in terms of what we do, not just in the HIV space or in the health sector space, but more broadly as Africans. So President Kagame said, and I quote, "I would rather argue that we need to mobilize the right mindsets rather than more financing. After all, in Africa, we have everything we need in real terms. Whatever is lacking, we have the means to acquire, and yet we remain mentally married to the idea that nothing can get moving without external finance. We are even begging for things we already have. That is absolutely a failure of mindset." Thank you, Tian. I will stop there and hopefully have this really wise words from President Kagame resonate in terms of through various aspects of our lives. And this is just not about financing the HIV world, but a lot of the challenges or problems that we face on the African continent.
Absolutely. Thank you so much, Suzu. What a beautiful way to end the discussion. Dr. Izukanji Sikazwe is a Zambian scientist and researcher who leads up the Zambia Center for Infectious Disease Research, or CIDRZ, and is one of the BRILLIANT Consortium leaders in Zambia. Thank you so much for your time. You've been listening to the African Alliance podcast, the Brilliant series, bringing you these incredible stories of passion, innovation, and change that take us a step closer to an HIV vaccine. We're constantly inspired by the work being done by our guests, and I hope you are too. The work doesn't stop here. There's always more to learn, more to do, and more to connect with. Stay curious, stay engaged, and we'll be back soon with another inspiring episode. From pioneering scientific research to impactful community activism, the individuals we feature on this show are not just changing their fields, they're shaping the future. To learn more about the BRILLIANT Consortium and how you can get involved, visit africanalliance.org.za and follow us on social media. If you've enjoyed today's episode, don't forget to subscribe, rate, and share the podcast so more people can hear these powerful stories.